All right, good afternoon, class. This is Physical Agent Modalities, Hosni Amira. This is the second video. We stopped at slide number 9, conductive heat. And this is the superficial heat that we were talking about. And this can take many variations or shapes. Um, there we have commercial hot packs. We have the traditional one, which is everybody knows about right over here. Those are your hot packs that come out of the hydrocolators. In this picture here, it's featuring the Chattanooga hot pack machine hydrochlorator. We have electric ones, and again, this is not endorsing any product, but this is the one that it produce moist heat. Unlike, the ones we use to warm up ourselves in the winter time, those actually produce moist heat that is easier to penetrate through the tissue than just dry hot pack, electric hot packs. Microwavable ones are really good. They're usually lightweight, made out of special material, and you heat them up for a minute, minute and a half. They're really good for, again, lightweight. Um, if you're doing home health visits, they're really good for that. You take them with you. Obviously, you gotta put them in a pillowcase or a towel or something for infection control between patients. Um, if you end up using any microwavable hot packs, I would caution you to read the instructions really, really carefully. They have very particular way of doing those. So you heat up most of the times, again, read the instructions, but you heat it up for 90 seconds and let it sit for a minute for the heat to equalize amongst, the different parts of the hot pack. Because just like we use the microwave to heat up your dinner. Sometimes there are areas that are more hot than others. Same thing for the hot packs. So read the instructions most of the times 90 seconds, and then you let it sit for a minute for the heat to distribute evenly, and then you apply it to the client. I've seen reusable chemical ones, such as in this pouch. Again, it's not endorsing this brand, but some of them are they come in with a small disc that is a penny-sized disc, and then you pinch that disc, and uh, starting in a chemical reaction, it heats up that hot pack for a little bit of time, and then you reuse it by putting it in boiling water. So again, those are reusable based off of a chemical reaction, and there are obviously one-time use hot packs. There's pros and cons for each and every one of those. It depends on the setting. It depends where you are. So use what fits your situation better. There are ways to make your own makeshift hot packs you probably can find some online, but I would caution you to do that because it's unreliable. It might injure or burn the patient. So try not to use makeshift hot packs. Now, what does the hot pack do? The purpose and effect? It usually increases local metabolism. It increases local perspiration, sweating because of the increased blood supply to the area. There is local vasodilation occurs usually by initial vasoconstriction. So usually when you put a hot pack on a client's skin, uh, not directly on the skin, but properly clothed, you put it on the client, there is usually vasoconstriction and followed by vasodilation. Then there's expansion of the blood vessels, uh, allowing more blood flow to the area. There is muscle relaxation is usually promoted by the superficial heat, and sensory nerves are usually numbed or sedated by the heat. So it's a good way to increase metabolism, increase blood flow to the area, and also numb the pain. Negative effects of the hot packs, usually the response of the heat usually dissipates after a while because the human body try to maintain a state of equilibrium. So try to usually the heat dissipates. It will increase the body temperature. So if somebody has any fever or any, so it could increase their fever of the overall body. It might affect their respiration and pulse rates, and eventually, again, there will be some blood pressure issues. It could use reduce the blood pressure. Um, there is pigmentation of the skin you might occur on that area that you treat. Capillary pressure and cell permeability are increased with which can promote edema. So if you're not careful, you could produce more edema to an affected area just because there is more capillary pressure and permeability of the cells are increased. Now, the advantages of hot packs are they become cooler during treatment, which means that you can put it on the client, and then once you establish that it's not too hot, then it's unlikely to become more hot. And, caution you, obviously, if using the electric ones, you have to be careful not to overheat the tissue. Another advantage is you can add an extra towel, and that would, you can reduce the intensity of the heat by extra towel or extra insulation. You can easily treat localized area. So if you're targeting the shoulder area or lower back or upper neck or whatever it is, your treatment is localized. The three disadvantages or some of the disadvantages of heat, usually those hot packs may be heavy, especially the traditional ones. And if you have any injuries or pressure sores, or it might be aggravated by the heavy weight of those large hot packs. Um, contact from packs may be an avenue for infection. So, especially if there's open wounds, obviously you take precautions against that by discarding towels and insulating those hot packs properly. Usually, the area that you treat is not visible, so you have to inspect the skin before and after and monitor the skin throughout the 15-20 minutes treatment process to uh, to counteract any issues. When do we use hot packs or superficial heat? Two main uses for subacute and chronic inflammation or injuries. So a day or two after the injury, you would use ice or cold, and then a few days after, or for chronic arthritis, for example, chronic low back pain, you could use hot packs. I have seen therapists use it as a preheating, preheating prior to electric stimulation. So some therapists say that heating a tissue uh, will increase the effectiveness of any electric stimulation. And I have seen therapists who would use electric stimulation and hot packs at the same time to for pain, etc. It's contraindicated. The heat hot packs are contraindicated in acute inflammation. Somebody has an injury, they sprained their ankle, they pulled a muscle or something, then this is an acute injury, acute inflammation. We would not use heat, so it's contraindicated. Do not use it. If a client has a fever already, don't use heat. In case they have cancer or malignancies or such, we would not use hot packs, so it's contraindicated. The theory behind it again is to reduce. You don't need to increase blood flow to an area that has active malignancy. Uh, Breast cancer, for example, you would avoid using hot packs over around the neck or around the shoulder. Again, if it's a breast cancer that has been removed or cured or treated, then it's fine. You can use hot packs. But if it's an active or if there's any suspicion of any malignancies, I would not do that. People with prostate cancer, for example, you avoid using it on their lower back because you're too close to the prostate and the circulation to that area. Uh, Thyroid, so try not to use hot packs around the neck, etc. Again, you don't want to increase the blood supply to an area that has any active malignancies or cancers. If there's any number four is active bleedings, acute traumas, etc. Obviously, you don't need to increase blood flow to an area that's already bleeding. Contraindication continued, so cardiac insufficiencies uh, again might be affected by putting extra demand on the cardiovascular system by increasing the blood flow to one extremity over another. So people with poor ejection fractions, for example, patients with congestive heart failures and things like that. If it's mild, obviously maybe okay, but you know, you still have to exercise caution. Elderly and children, uh, they may not be they may be unreliable with their thermoregulatory system, so I would be careful with overloading their physiologies by using hot packs. Peripheral vascular diseases, again, uh, any area with poor circulation, you have to be careful with using hot packs. uh, Tissues after an X-ray is another one. So the theory behind that is you don't need to increase blood circulation for an X-rayed wrist, for example. If the patient fell and have an X-ray on the wrist, you don't need to increase the circulation so the X-ray that is lingering around in the tissue does not get carried around to other parts of the body. Precautions, those are things you have to be careful with. Edemas, for example, you can use hot packs, but you have to be careful. If they have edema, use it, mild intensities, careful monitoring with elevation will probably be fine. Loss of sensation, such as in a stroke or peripheral nerve injuries, you have to be careful just because there is unreliability in the heat sensation. uh, Patient who are confused, very old, again, they might not communicate with you if there is any issues with the hot pack getting too hot. So this is precautions. You can do it, but you have to be careful. Um, the instructions when you apply a hot pack, usually always number one is to instruct the patients. We will talk about this more in the lab, but always instruct the patients what to do. You inspect the skin before. I always inspect the skin of a client before I apply hot packs. They might be bruised, they might be uh, scar, surgery scar. There might be hardware in there. If you're doing it on the shoulder, there might be a pain patch, a medication patch. You don't want to increase blood supply to an area that has chemical medications, and it might affect the delivery of that medication. So inspect the skin before. Always get a good visual on the area that you're going to put a hot pack on. Remove any jewelries. Again, if somebody has a necklace or a bracelet or something, you don't want to heat that metal more than it needs to be. So you remove that. You position the client and drape them appropriately to cover the area with a towel. Use a pack of appropriate size, the cervical ones or the small ones on the lower back. Um, and you use the commercial cover that comes with it. You use extra towel or 2 or 3 as needed. I don't use 6 or 8 layers of toweling. It's too much. Usually 2 or 3 towels would be fine. Uh, you securely place that pack on the area that you need to be treated, and by securely meaning that it has a constant contact with the skin, so it does not come off if the client starts moving around, unless it's an intentional. They're trying to remove it because it's getting too hot. Explain to the patient, to the client, that the heat should be comfortable, warm, but not too hot, obviously. You cover the entire area with a sheet so to kind of capture that heat so it doesn't escape. Um and then, you control your dosage based on the client's tolerance. You add and remove towels as needed. I always provide a call system if I am in the gym working with the client, or if in the room or something. The client should be able to call for help if the hot pack gets too hot or if it needs to be removed. Ideally, this patient should not be left unattended, but if you do need to turn around or do something, then you need to allow a call system for the patient. Um, you make any necessary adjustments if the patient is complaining. Uh, Once in a while, check on the skin. The first 3 or 4 minutes are the most crucial because that's when the heat starts going through the hot packs into the client's tissue. Uh, about 15-20 minutes, and then the treatment will be over. And then if you're doing electric stimulation, then 10 to 15 minutes, and then that is sufficient. 20 minutes into the hot pack starts cooling down, so it needs to be removed. And you dry the client, you cover him up, you check the skin again, just make sure there is no unwanted physiological responses, uh, or redness or more swelling, and then you replace your hot pack where it needs to go, and then you continue your treatment as soon as you can. Do not wait 10-15 minutes after, because by then whatever physiological effect that you're trying to capture has already started to dissipate. So as soon as you put away the hot pack, you need to continue your treatment as usual, whatever that treatment. It could be passive mobilization, it could be stretching, it could be electric stimulation, it could be manual mobilization, whatever it is, it needs to be continued immediately after. A frequency, subacute problem, hot packs may be given daily or even multiple times a day, as often as possible. It doesn't matter, because this is a localized treatment without a whole lot of side effects, so you can use it as frequent as the patient needs it. And then the frequency may be decreased if the patient is improves or you're trying to move on to a different modality. So that's it for the hot packs. Next, we will talk about paraffin baths.